welcome to my channel. This is Chimax, also known as Chimax. Today I'll be talking about important reasons why you should take care of your kidneys. This topic is very important. Once you are done watching, you really need to share it to your loved ones so that they will know about this reason and be able to put it into practice. This video is actually all about describing the life of a patient living with kidney failure, their life challenges, and it should motivate you to take care of your kidneys. Okay, one of the reasons why you should take care of your kidneys is the financial burden of managing kidney failure. Hope you know that kidney failure doesn't have a cure. Kidney failure do not have a cure. There's only two ways you can manage kidney failure, which is one, dialysis and renal transplant. That's transplant. And dialysis and this transplant, no matter how rich you are, no matter how wealthy you are, kidney failure will crumble your wealth. I'm not talking about people that are staying in developed countries that they're insured. You get people where the places where they work take care of their dialysis or their health. I'm talking about like developing countries like Nigeria. If you come down with kidney failure in Nigeria, like the whole financial burden, it's on you, and it's not funny. No matter how rich you are, no matter how rich. I'm going to be talking about the prices in Naira now. Let's talk about hemodialysis now. Someone that has a kidney failure should be getting dialysis like 3 times weekly or 2 times. Let's assume standard should be 3 times weekly. Okay, that 3 times weekly. A session of dialysis is 30,000 naira. And you should have this dialysis 3 times in a week. That's how much? 90,000 naira. This is just the dialysis. There are many investigations which you should be carrying out, which is expensive. There are drugs that you need to be taking, which are still expensive. The financial burden of kidney failure is really out of hand. That is why you always see people, whenever you see people soliciting for funds, there is a 70% chance that the person is suffering from kidney failure. And when you see the amount they need, it's always in tens of millions. Yes, the financial burden is out of hand. Even the kidney transplant. Hope you know that kidney transplant is not a cure for kidney failure. Like, it doesn't really end it. Even if you've had kidney transplant, you still need to be on drugs for life, or as long as that kidney is still functioning, and those drugs are quite expensive. Honestly, the financial burden of managing kidney failure, it's not funny. Like, seriously, that is why you see a lot of people advocating for the government to step in to at least subsidize these prices, this lots of money for them. Okay, the next point is alteration of body image. Once someone gets kidney failure, they change. Like, most times they change. If you see the fair ones, they look darker most times. You see the big ones, the chubby ones, sometimes they slim down. You see these chubby one, the slim one, they are so big because of the accumulation of fluid. You see their legs, most times, though not all patients do have water retention, you see their legs so swollen that they can't even wear their shoes, the shoes they need to wear. Like, their body image sometimes as a nurse, because I'm a nephrology nurse, I work in a dialysis unit, patients will tell you, "Hi, Nurse Chiamaka, see, I am looking like I don't even look like myself." That whenever he or she looks at the mirror, that they don't even recognize who they are. Like, your body image is going to be altered. And you know, the body image, it has a lot to do with self-esteem. Imagine someone that is very conscious of her look, that is very fair and beautiful, or a very slim fit, and the person has a protruded tummy, that's ascites, or swollen legs. The person's self-esteem is going to be tampered. So that's the second reason. The third reason is dietary restrictions. Yes, once you have kidney failure, there are some foods that you should be avoiding, or if you are taking it, you need to take it with care. Yes, if someone has kidney failure and you're the type that like fruits, especially banana, you have to reduce the way you take banana, because banana is very high in potassium, and you know what high potassium can do to the heart. So do you understand? So there are a lot of dietary restriction. You have to reduce your protein intake, because the kidney is not really working to take this out of the system, so it's accumulating in the blood. So what do? The dietary restriction will help to reduce those waste from accumulating in the body, which is not funny. Imagine if you are the type that likes drinking, maybe taking drinking milk, you like taking proteinous food, like eating fish, meat. You can't take those food the way you want. You can't take it, or else you're really going to have a serious problem, like it might even cause death. It's that difficult. So seriously, the dietary modification is really, it's not funny. Like, it's really not funny. Even taking of water, like this period I'm making this video, the hotness, as in the weather is so hot that everybody is sweating. Do you understand? And this because people that has kidney failure, they won't be taking, they are restricted from taking a lot of water. They're restricted from taking a lot of water. So it's not funny. That's just it. The dietary restriction is not funny. And the next point is anxiety. Yes, anxiety, in the sense that, like, you are living in fear. You don't know what tomorrow will bring up, because you know how kidney failure is. Today you are okay, agile. The next day you are you're anxious. Do you understand? Fear of unknown. You don't know. Sometimes when you come for dialysis, you ask of your friend or someone you saw yesterday, will tell the person is late. You kind of scared, because, like, you understand, they are so scared. Some people are like, as a normal person is preparing for future, doing this, so like living with kidney failure, sometimes they just their own is, let me just be healthy, let me just be like, you understand, they are kind of, some of them are scared, like fear. They always fear of tomorrow, like they don't know what tomorrow will bring. The next point is limitation in some activities. Like, if you're the kind of person that does strenuous work exercises, like maybe you gym, you carry weight, or you run, or you like boxing or football, like kidney failure is going to affect it. Like, you'll not be able to play. Even if you do, it's not going to be the way you used to play. Do you understand? So it's going to, kidney failure messes with your, like, it's kind of change your life. So you imagine you're kind of person that goes to the gym, carries heavy weight, all those heavy weight that men do carry, you carry it. Once this thing comes up, it's not even advisable to do that. Like, it's not. So it's really going to limit you. The next point is moving from being independent to being dependent. Like, being dependent is going to come in different forms. It might be, maybe you're a type of person that is independent, not that you're too rich, but you take care of pay your bills, you feed yourself, you don't ask people for help, you're always on your own. Do you understand? When kidney failure creeps in, oh god, you're going to seek for help. That help, definitely you're going to seek for it, and you're going to be dependent on people to live. Like, it's not really funny, especially people that have ego, people that don't, not even ego, people that don't like depending on people. Like, people like me, I don't like begging people for anything. Like, if I can be on my own, like, I like being on my own. The little I have, I manage it. I don't like begging anybody for anything. So there are people like that. So if kidney failure creeps in, you're definitely going to seek for help, because there's no how you can do it on your own. It's not possible. The financial distance, as I explained earlier, is crazy. Not aside the financial dependence on people, you can be physically dependent on people. Like, maybe the CKD can be so bad that you can't walk. the what fluid can accumulate in the lungs that you can't breathe, that people will have to rush you to the hospital. Sometimes all those activities you are doing, not even strenuous activities, normal activities, standing up, walking, it can get so bad that you can't even walk again. It may affect the bones, because if you watched there is a video I made about functions of kidney. You need to watch it so you know the relationship between kidney and the bones. So seriously, it's really not funny. All those normal activities, you come, go to toilet, you come, you cook your food, you'll not be able to do it. People will be doing it for you, and this is something, I don't know, it's not, it's painful. Do you understand? It's really painful. So it will make you from being independent adult to becoming dependent on people again. Seriously. So this is where I'm going to stop for now. This is just a way of me telling people to, encouraging people to take care of your kidney. I've made videos on how to take care of your kidney, which you can check my videos to know how to take care of your kidneys, because this kidney failure, like, let me tell you something. I work in a kidney center, like I work in a dialysis unit. As people are doing transplants, the workload should reduce, right? But it's not reducing, it's increasing, because people are getting down with kidney failure. I'm scared. Like, I'm like, everybody is scary. So this is why I want to, like, I'm really taking it upon myself to educate people about kidney. I talk about a lot of health issues, but I take kidney this thing serious, because people are really getting kidney failure, like, every now and then. Like, seriously.